Are you on thyroid replacement but still feel like you have symptoms of hypothyroidism? Perhaps you've been on thyroid for a while and you still feel sluggish, you feel tired, maybe you have constipation, joint pain, you have foggy thinking. Many symptoms are related to low thyroid, and you're wondering, why am I still feeling like this? I've been taking my thyroid medication from my doctor, tells me my blood tests look good, yet I still have these symptoms of low thyroid. Well, the problem certainly could be that you have suboptimal or low levels of T3. You see, most of the thyroid medications that people take, like Synthroid, Levoxil, levothyroxine, these are known as T4, which is a main type of thyroid hormone. But really in the body, when you look at the physiology, T4 is mainly the storage hormone. Its main function is to be converted into the more active T3, also known as liothyronine. So with patients, I'm always looking at different biomarkers of thyroid function. Most doctors test a TSH, thyroid stimulating hormone, which is a message from the pituitary gland to the thyroid. And then sometimes they measure your T4 level as well. Unfortunately, most doctors aren't measuring the total T3 and the free T3, which is the most dominant, the most biologically active of the thyroid hormones. So some people, because of nutritional deficiencies, they might be low in iodine, they might be low in selenium, they may be low in zinc or copper. All these things are involved in thyroid metabolism and can lead to low T3 levels. If you have liver problems or kidney problems, that can prevent the conversion of T4 and T3. If you're under high stress or certain pharmaceutical medications prevent the conversion from T4 into T3. So with a lot of patients, we'll use a combination therapy where you have the T4 and you have the T3. And so this is available from regular pharmacies and even more so from compounding pharmacies. And so for a lot of patients, that combination therapy will work better. And they have done studies on this. Our research suggests that up to 20% of people who are on just the regular T4 therapy don't feel like their symptoms have been taken care of properly with thyroid replacement. So at least 20% of people out there on thyroid replacement, T4 therapy, would benefit from adding T3. Now, we find that percent is a lot higher because we're not just looking to get rid of the symptoms. We want people to feel optimal for their energy, their cognitive function, their vitality, many other symptoms related to thyroid. Because remember, thyroid hormones essentially affect every cell in the body, and they're regulators of metabolism. And so if you have suboptimal or low T3 levels, there's no way that you can have optimal health. So when we're doing thyroid replacement, the types of thyroid we typically use would be, for the T3 would be, you can use the regular form called Cytomel from the regular pharmacies, but the better therapy, in my opinion, is the sustained release T3 you can get from compounding pharmacies. And the reason for this is when you give regular T3 to a patient, it has most of its biological effect within about 3 to 4 hours. This is why we like the sustained release form for most patients, because it's going to be active a lot more during the day. And for a lot of patients, we'll have them take it twice a day so they have optimal levels throughout the day. So that's helping in their metabolism. It's helping their weight. It's good for people who are prone to water retention, who feel sluggish during the day. So this is something to talk with your doctor about in terms of, are you a candidate to have T3 therapy for your hypothyroidism? Well, I have many videos on hypothyroidism, on hormone replacement, and so check those out on my YouTube channel.